Hello, my name is Zishan Sharif and I'm a PGY3 resident with the Wayne State University Family Medicine Program in Rochester Hills. I am a part of the QI team that looked at the implications of adherence to the heart failure clinic on readmission rates to the hospital. Heart failure is a complex clinical syndrome characterized by the reduced ability of the heart to pump and/or fill with blood. It is a global health issue that results in frequent hospitalizations and high mortality rates. With the prevalence of heart failure estimated to increase by 46%, the burden on the healthcare system will invariably increase if there aren't any specific interventions. Survival rates for heart failure are poor, with 70% in the first year and 35% after 5 years. Previous studies have showcased the merit of one-on-one teaching of heart failure management, resulting in decreased readmission rates. With this in mind, we formulated our study focused on increasing attendance to the heart failure clinic at Ascension Providence Rochester Hospital. Follow-up at heart failure clinic is recommended to all heart failure patients at discharge to promote optimal medical and lifestyle management and decrease subsequent readmissions. Previous studies have highlighted a large cause for admissions to be confusion regarding medication management, along with signs and symptoms to monitor for. However, with that being given, attendance at these visits in the past year was low at 14.9%. The heart failure clinic is headed by a heart failure nurse practitioner who counsels the patients during admission, provides them with resources, and follows up with them after discharge to go over medication and lifestyle management and clear up any confusion. Heart failure readmission rates at Ascension Providence Rochester Hospital in 2019 were at 18.8%, which exceeded the target of 15.10%. To conduct the study, we employed the PDSA model of plan, do, study, and act. In our intervention, we called heart failure patients 1 to 2 days after discharge to ensure follow-up appointments were scheduled and explore any attendance barriers. We then documented these attendance barriers and chart reviewed to determine readmission rates. Our team consisted of 5 residents, an Ascension Heart Failure Clinic nurse practitioner, and IT. Our intervention was implemented by residents over 2 months. We documented 8 heart failure patients that were discharged and contacted. When evaluating our data, a comparison of pre- and post-intervention showed a 50% increase in clinic attendance, which was quite the jump. We then took this information and cross-referenced it with the 30-day readmission rate, and what we found was that for those that attended, none were readmitted, and for those that did not, about 37% were readmitted. This falls in line with a study published in 2018 by Kozer et al. Regarding readmission rates for non-adherent patients. Common barriers to attending the heart failure clinic post-discharge were frustration with too many appointments, confusion as to why to attend because patients already had access to home care nurse, a PCP, or even a cardiologist, lack of transportation, or they were living in a nursing home and were not able to facilitate an appointment. Calling patients immediately following hospital discharge appears effective in improving their heart failure clinic attendance and subsequently decreasing readmissions. The heart failure clinic plays a unique role in managing patients post-discharge, one that patients often overlook. However, we do need additional work to improve intervention feasibility, including utilization of hospital heart failure team spreadsheets to track follow-up calls, creating a shared calendar for scheduling and confirming heart failure clinic appointments, documenting calls in the EMR to improve interdisciplinary communication. Simple protocols like phone calls may promote the continuity of care necessary to minimize readmissions and subsequently improve patient quality of life. Thank you.